Hello, friends. No health is possible without caring mental health. Today, we'll discuss how thinking process, perception, and affect is important to decide where someone is suffering from a mental disease or not. If someone close to you, at your home, nearby you, in vicinity with you, is having distorted thinking, distorted perception, and having blunt effect, must ask him, are you feeling significant impairment in academic, occupational, or social functioning? Ask them, have you become suspicious and bearing grudge and a feeling of victimized? Ask them, are you hear, see, feel, or smell something that is not there and that is not being perceived by others close to you? Ask them, have you felt this way for a long time? If the answer is yes, of course, it is nothing but schizophrenia. Welcome, my friends, on the World Schizophrenia Day, 24th May 2021. I am Dr. S.K. Pandit, head of the Department Psychiatry, Central Hospital. I welcome all my audience on this World Schizophrenia Day to discuss so many queries related to schizophrenia and to resolve them. And in this way, we can elevate the mental health of the community by standing together. So let us stand together to remove the stigma attached to schizophrenia and so many other mental health. There is no difference between acute schizophrenia and a world at war. It is said by the great Juvak. So, schizophrenia is such a mental disorder that destabilizes the behavior of the person and his emotion, in which the person finds it difficult to follow the natural thinking process and distinct reality from the fantasy. On this World Schizophrenia Day, 24th May 2021, I pledge to stand against schizophrenia, and I request all of my friends of different community and of different country to pledge to stand against schizophrenia. To diagnose schizophrenia, there are different guidelines, but as per the guidelines given by International Classification of Mental and Behavior Disorder, ICD-11, it says that although there is no strict pathognomic symptoms that can be identified for a practical purpose, it is useful to divide the above symptoms into groups that have special importance for the diagnosis and often occurs together. These groups are ABCD, where in A group there is thought echo, thought insertion or withdrawal, and thought broadcasting. Group B, delusion of control, influence or passivity, clearly referred to body or limb movement or a specific thought, action or sensation or delusional perception. In C, hallucinatory voices giving a running commentary on the patient's behavior or discussing the patient among themselves, or other type of hallucinatory voices coming from some part of the body. In group D, persistent delusion of other kind that are culturally inappropriate and completely impossible, such as religious or political identity or superhuman power and ability, as for example being able to control the weather or being in communication with the aliens from another world. In group E, persistent hallucination in any modalities of senses, when accompanied either by fleeting or half-formed delusion without clear affective content, or by persistent overvalued ideas or vain occurring every day for weeks or months or more. Group F, break or interpolation of the train of thought, resulting in incoherence, irrelevant speech, or neologism. In Group Z, there is catatonic behavior, psychomotor retardation, or excitement, posturing, flexibility, negativism, mutism, and stupor behavior. In Group H, negative symptoms such as marked apathy, paucity of speech, and blunting, or incongruent of emotional response, usually resulting in social withdrawal and lowering of the social performance. It must be clear that these are not due to depression or due to neuroleptic medication. And Group I, a significant and consistent change in the overall quality of some aspect of the personal behavior, manifest as loss of interest, aimlessness, idealness, a self-absorbed attitude, and a social withdrawal. These are the few symptoms in group as per the International Classification of Disease. There are different kinds of schizophrenia with different pattern of courses. These courses might be continuous, episodic, with progressive deficit, or with a stable deficit, or with remission, either incomplete remission or complete remission. Different kinds of schizophrenia as per ICD is paranoid schizophrenia, haverphrenic schizophrenia, catatonic schizophrenia, undifferentiated schizophrenia, post-schizophrenic depression, residual schizophrenia, simple schizophrenia, and other kinds of schizophrenia. Out of that, catatonic schizophrenia, the few symptoms of this kind of schizophrenia is again having A, B, C, D, E, F, G, H group, where A symptoms are stupor, marked decrease in reactivity to the environment, and in spontaneous movement and activities, or mutism. It might be excitatory type, where there is apparently purposeless motor activities not influenced by the external stimuli. Group C, posturism, D, negativism, E, rigidity, F, flexibility, and G, other symptoms such as command automatism, automatic compliance with the instruction, and preservation of words and phrases. Out of different kinds of schizophrenia, paranoid schizophrenia is the most commonest type of schizophrenia in the most part of the world. And the example of the most common paranoid schizophrenia are A, B, C. A, delusion of persecution, delusion of reference, delusion of exalted birth, special mission, bodily changes, or delusion of jealousy. In B group, hallucinatory voices that are threaten the patient or give command, or auditory hallucination without any verbal forms, such as whistling, humming, or laughing. In Group C, hallucinations of smell, taste, or the sexual behavior, or other bodily sensation, might be visual hallucination, but are rarely predominant. Thought disorder may be obvious in acute state, but if so, it doesn't prevent the typical delusion or hallucination from being described clearly. Affect is usually less blunt than in other varieties of the schizophrenia, but the minor degree of incongruity is common. As are mood disturbance such as irritability, sudden anger, fearfulness, and suspicious behavior. Negative symptoms such as blunting of the affect and impaired volition are often present but do not dominate the clinical picture. The course of the paranoid schizophrenia may be episodic with partial or complete remission or might be chronic. In chronic cases, the florid symptoms persist over the year and it is difficult to distinguish discrete episode. The onset tend to be later than in the schizophrenic and catatonic forms. Diagnosis of schizophrenia fall under the block F20, but before giving the final diagnosis of schizophrenia, the doctor must differentiate with the schizotypal disorder and with the persistent delusion disorder and ATPD, that is acute and transient psychotic disorder, where in case of ATPD or acute transient psychotic disorder, an acute onset within 2 weeks as the defining features of the whole group. The persistence of typical syndromes may be there and the presence of associated with the acute stress would be there as one of the important history. So it is very important to recognize schizophrenia and to treat it timely, and not only that, the few preventive measures are there which are proven very important, and those are the lifestyle modification to fight the schizophrenia. Those lifestyle modification tips are: number 1, eat plenty of fruits and vegetables. Take a gentle exercise every day. Get 8 hours sleep every day and relax with yoga or meditation. Do not drink, do not consume tobacco, and do not take drugs. Spend time with the friends and family, and if any distortion of thought, perception, or behavior is recognized, then immediately meet to your psychiatrist. If there is irrational, unpleasant behavior is reflected, then meet to your psychiatrist. If a persecutive idea persists for a long time, if jealous idea persists for a long time, if anger outburst occurs without any reason, these are the symptoms. If there is a blunting of affect, no smiling on the face, then these all symptoms are very important, and that should be taken care to fight against schizophrenia. Let us discover better mental health. Let's stand together to remove the stigma attached with schizophrenia. Thank you.